Patient and family engagement in healthcare is at a crossroads. Over the last several decades, we've accumulated significant evidence about the compelling benefits of engaging patients and families in their care. For example, at a leading medical center, implementing patient and family engagement strategies on one hospital unit led to a jump in patient satisfaction scores from the 10th to the 95th percentile. And one study found that when patients got objective information on treatment options, about 25% of individuals selected a more conservative, evidence-based treatment than was originally proposed, which resulted in an average savings per treatment of more than $11,000. But despite evidence of its value and benefits, meaningful patient and family engagement remains the exception, not the rule. What would it look like if this changed? Picture this. Patients and their families are active participants in their care, working in partnership with clinicians. They are prepared and have support to engage, including knowledge and information about their health, conditions, illnesses, and diagnoses, and what they need to do to stay healthy. Healthcare organizations use technology to increase transparency and facilitate information sharing via portals that give patients full access to their electronic health record and clinical notes, and the ability to communicate with their healthcare team. Healthcare decisions occur through meaningful conversations among patients, families, and the healthcare team. Patients' preferences and opinions are elicited and considered, along with medical research and guidelines, in decision-making that helps patients accomplish their health and life goals. Patients are encouraged to communicate with their care team in ways that match their needs and preferences. And the system recognizes that not all patients are alike, tailoring communication to individual needs and addressing issues of language, literacy, and cultural and ethnic diversity. Patients and families also have an active voice in shaping the way care is delivered. They serve as patient and family advisors, sharing ideas about how to improve care. They participate on quality and safety committees and have access to organizational quality and safety data. They serve as healthcare organization board members. They are partners in determining organizational policies and procedures and establishing a culture that fosters continuous improvement and innovation. This type of real organizational change benefits everyone. For example, when patient and family advisors guided the development of a neurology and neurosurgical center over 3 years, there was a 62% reduction in medical errors. This vision of patient and family engagement extends beyond any one care setting. Patients experience effective coordination, seamless transitions, and continuity of care as they move between care settings. Assisting these transitions is a strong link between the healthcare delivery system and the communities where patients and families live. Community needs are respected, and community resources are used effectively. Finally, this vision of patient and family engagement extends to public policy, where patients and families help make sure national, state, and local policies and programs reflect the needs and interests of patients and families. This means patients and families have open access to policymakers and are included on committees that implement policies and programs. When all of these things happen, we shift our paradigm from a medical model of care to a person-oriented model of care, from a system that focuses on treating illness to one that promotes health, from a system that does to and for patients and families to one that does with them. And we take big steps toward achieving important outcomes: better health, improvements in patient safety and quality, lower healthcare costs, and better experiences of care for all parties: patients, families, and clinicians. Is the vision ambitious? Yes. Achieving it requires all of us working together in clear and coordinated ways. The Roadmap for Patient and Family Engagement in Practice and Research helps organize our efforts, illustrating pathways for creating meaningful partnerships, describing key milestones, and listing strategies and tactics to advance the work of patient and family engagement. We invite you to join us as we work together toward a new vision of healthcare.